Hey everyone, my name is Jessica Metz, and the topic that I chose for my behavior change project was the effects of differential as well as non-contingent reinforcement on reducing escape behaviors during non-preferred activities. So there's been a lot of research, of course, on differential reinforcement as well as non-contingent reinforcement. They're very popular topics within the field of ABA. However, one thing that they haven't researched a lot is non-preferred activities. And one thing that I really wanted to look at with one of my kiddos is if these two ABA topics can be used to reduce escape behaviors during non-preferred activities. The child that I work with is 10 years old. I've been working with him for a long time now, and in just the past recent months, he's begun to engage in severe tantrum behaviors in order to escape non-preferred activities. These non-preferred activities include things such as chores, playing games with younger siblings, as well as going on outings with mom, which usually involves grocery shopping, clothing shopping, anything like that. So we wanted to see if the purpose of the study was to see if non-contingent reinforcement as well as differential reinforcement could be used to decrease these tantrum behaviors. So we define the ability to wait to terminate a non-preferred activity as engaging in a non-preferred activity without tantrum behaviors, which for the child that I work with, this would be defined as screaming, which is high-pitched vocalization that can be heard in the next room, whining, a long nasally low-pitched vocalization, or flopping, which is the thrusting of the body downward and repeatedly making contact with the surface, until a termination cue is given or the activity naturally ends. We also wanted to teach him how to appropriately ask to terminate an activity that's non-preferred, which involves asking a caregiver or grown-up responsible for him if he's able to leave the activity in a very calm voice without engaging in problem behaviors that I have just defined for you. So the procedure for this study basically involved a multiple baseline across settings. So the three settings that I had previously mentioned were chores, going on outings with mom, and playing games with younger siblings. So these were all non-preferred activities that were chosen by a preference assessment that we did on him. A reinforcement preference assessment, we chose the ones that were very aversive or non-preferred for him. So during the intervention phase of this treatment plan, he was presented with a prompt to engage in a non-preferred activity. If he was able to appropriately finish the activity without engaging in any problem behaviors that I defined, he was able to move on directly to a preferred activity. However, when he engaged in inappropriate tangent behaviors, differential reinforcement was practiced. So the mom and dad were trained on this, and they were actually the ones taking data because he's in the process of ending his ABA therapy because he doesn't need it as much anymore. He doesn't need that intensive ABA that he used to need. So we're doing a lot of parent training on mom and dad. So they were heavily involved in this study. And so basically, this helped them too in the future to, for mom not to reinforce his escape behaviors by removing him, which happened in the past. So this time, if he engaged in inappropriate tangent behaviors, differential reinforcement was practiced, and this involved extinction while he engaged in those tantrum behaviors. So the extinction was practiced for as long as the tantrum persisted, and then as soon as the tantrum was over and he asked to terminate the non-preferred activity, he was allowed to move on to the preferred activity. So the observations took place during his ABA therapy, and the lead therapist, which is myself, practiced the IOA for the intervention, and so I was there and doing IOA 50% of the time on mom and dad. So the results showed that while the overall baseline for him showed that he was able to engage in non-preferred activities 22% of the time without engaging in tantrums, at the end for going grocery shopping with mom, he was able to do this 26.6% of the time, 36% of the time when playing non-preferred games, and 48% of the time when doing chores. So by far, doing chores really improve for him. He was able to do it almost half the time without engaging in problem behaviors. And I should have mentioned that we only took data for 5 sessions for each environment. So, without a doubt, I think this is a limitation, that the longer that the study would have persisted, we would have seen even more of those results. So the results that I showed you really, show that using this differential reinforcement and non-contingent reinforcement are really effective at increasing his compliance during those non-preferred activities. And this was true in all settings that we did it in. So this is in conjunction with previous studies that show that non-contingent reinforcement and differential reinforcement can reduce maladaptive behaviors. And then what I have shown is that it can reduce maladaptive behaviors in this particular setting of non-preferred activities. So there were some limitations. One came from data collections. It was only found, we were only able to take some of this data 1 or 2 different times a day because, you can only do so many outings, or you can only do so many chores. So this really limited the variability range of our data. So let's say that he was able to engage in it 1 out of 2 times. So that's only 50%. But, if we were to do 10 different trials a day, I'm sure we would have gotten a different number. So this could have had a significant effect on data. The other limitation that we had was that he was being taught with both non-contingent reinforcement as well as differential reinforcement at the same time, which could be a confounding effect. So if I were to do this study over, I would probably separate the two, and that way it would increase, the ability for us to tell which one really made the most difference in helping him reduce those behaviors. So thank y'all for listening. I hope y'all had a good semester and enjoy the rest of your summer break.